Hi everyone, this is Laura Pegram from NASTAD. Just wanted to give you a heads up that we are going to give a few more minutes for people to log on. There's a lot of interest in this. We've had almost 200 people register, and that's very, very exciting for us over here. So we want to give folks a good minute to log on. So we'll probably be starting right at around 12:05 Eastern.
Okay.
Hi everyone, just wanted to give this update again. We're going to give just a couple more minutes to allow time for folks to log on. There's a lot of interest in this, so you know, given everyone working at home, I assume this GoToWebinar and Zoom all might be running a little slower. So just a couple more minutes and we'll go ahead and get started. Glad that you're here. All right, so it is just about 5 past the hour, so I want to value everyone's time over here. So let's go ahead and get started. So welcome everyone. Today you've joined for the National Harm Reduction Technical Assistance Center webinar, sort of unveiling, and also a virtual town hall. We're really excited that everyone is here. We've had expecting nearly 200 folks to join the call overall. So I do want to give some quick housekeeping updates, just some quick notes that all of our attendees at this point will be muted from my end over here, and you are allowed to encouraged to type in any questions that you're having or any issues, you know, with the technology, either into the chat box, which is a function at the bottom of your screen, or sorry, within the dashboard. And then there's also a question box, a question pane. So either of those are acceptable, and feel free. And we really encourage your participation and involvement in engagement in this brief webinar and town hall. Another option, particularly for the second latter half of this is going to be the raise hand function, which you should be able to see right next to your name in the attendees list. And so if you have a comment that you would like to say rather than type, you can raise your hand, and we will try to open up just your line so that we are not flooding everyone with a lot of white noise and that sort of thing. So those are the key major points in terms of housekeeping. Again, my name is Laura Pegram. I'm a senior manager of drug user health here at NASTAD. I've been leading up a lot of our drug user health work here for the last several years, and I'm joined by the rest of our new drug user health team, by Lily Armstrong, who's also a senior manager of drug user health, Kirsten Forsyth, who's also a senior manager, and Virgil Hayes, who is a manager of drug user health. We are really excited to be here today, and there's a lot of work that has gone into getting up until this point, and so that is what we're hoping to get out of today. Ideally today, we're going to use this time to go over some of the background, the origin, some of the history of how this project came about. It's sort of exactly what it is, and then really spend some good time talking through what types of technical assistance are available to drug user health and syringe access programs, really doing a step-by-step sort of walkthrough of what that looks like and how to do it, and what feels available and possible. And then after that, we're going to open that up to answer any brief questions at that point in time, again, using the chat box function or the questions box or the raising your hand option. And so really want to kind of cap off the how to, what it is, and how to request TA. And then we're hoping to also use the second part of this this convening as a real opportunity to hear from you all who are either probably running programs or supporting programs, or just curious about syringe access programs and syringe services programs, and really try to hear from you all and hear a bit more about what your current technical assistance needs are, and maybe emerging technical assistance needs, and really just offering a space to have sort of a guided conversation around how we can do our job by of providing technical assistance to syringe services programs and drug user health programs more effectively and efficiently. So really encouraging some good dialogue and some good conversation there. Okay. So moving forward, I want to give a little bit of background just of NASTAD. NASTAD is an acronym that we don't typically use a lot anymore, but just to give some good context for folks on the call who might be less familiar with our organization. Historically, it's been the National Alliance of State and Territorial AIDS Directors, and there are lots of reasons that that is outdated, and in that we primarily work with state health departments with their HIV and viral hepatitis programs. So not only do we not do AIDS or just HIV. We also work with viral hepatitis programs, and increasingly with drug user health efforts across that are originating from state health departments or support programs that are supporting syringe access programs meaningfully in their states. So we work with all the 50 states and U.S. territories, and also work with the with the CDC federally funded jurisdictions. So those are metro statistical areas that are as large as some state populations, thinking about, say, for example, the District of Columbia, or that's not a good example because, yeah, anyway, it's a district, or cities like Houston or New York City who have populations and public health departments and needs that are equivalent to some of our smaller states. So really working with complex systems there. So we provide a variety of different types of resources and capacity building services for health departments to basically help to do, hopefully make their job a little easier, and make sure that they are creating programs that are meeting the needs of people who are either living with or at risk for HIV, hepatitis, and increasingly overdose. So that's really sort of the nuts and bolts of what we do here. So again, the things that we're going to go through, really just kind of going into the origin of this project, the overview overall, really talking about what this TA center looks like and how to actually, what it entails, what feels possible within it, what it looks like to request, and expectations that you all can have from us in terms of receiving technical assistance, and then wrap up with sort of the second half, which is going to be more of that virtual interactive. And then obviously we'll let you know how to contact us. So. Okay, so a little bit of background. So the National Harm Reduction Technical Assistance Center is part of a 3-year cooperative agreement that is funded by 2 different centers within the CDC. So the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention, NCHHSTP, it's a good acronym, and the National Center for Injury Prevention and Control. So they pooled resources and really came together with this idea a while back to basically support a 3-year cooperative agreement that has a couple of different components. And we're going to walk through just very briefly the different components so that there's some bigger clarity there about specifically what this technical assistance center and how it is and how it kind of fits into that overall picture, right? The overall hope and objectives for this 3-year project, right, is to strengthen the capacity and improve the performance of harm reduction programs across the United States, to implement a survey of syringe services programs and really help improve some of the monitoring and evaluation about program needs and helping to find ways to anticipate needs and identify resources to anticipate needs. And, at the end of the day, to really help make sure that programs that are opening or currently operating are able to do what we know that they can do, and are, really well poised to do, which is, prevent infectious disease resulting from injection drug use, and improve the overall health outcomes for people who use drugs. So again, 3-year cooperative agreement. It was awarded in the late fall last year, and we are excited and grateful to be partnered on this. And NASTAD was selected as a primary, and then we are partnering with our good partners over at AIDS United and doing this approach. So, like I said, there are a couple different activities, and we want to provide enough clarity to make sure that everyone understands where the TA Center kind of fits into this larger picture. So, the first component 1 of this larger cooperative agreement is the harm reduction technical assistance, right? And the technical assistance project has many different moving pieces, and we'll talk about that in just a second, but it also has a sub-project, sort of a component 1A, as we call it, that is designed, it's a demonstration project where we have gone through an RFP process and selected 8 different syringe services programs in the country, and they're receiving funding to create and implement an intensive patient navigation project within their current syringe services program. Hopefully, the idea here is really to document what works and what doesn't work, some challenges and barriers, with the idea of having more replicable information and tools to kind of, that might be useful for programs more broadly across the country moving forward. So that's the part that NASDAD and AIDS United are working on, component 1 and 1A. Component 2 was awarded to the University of Washington and their partners, and it's about monitoring and evaluation of syringe services programs. And one of the big components of this is about sort of restarting or starting a nationwide project to survey the current syringe services programs for different needs and resources, and it's similar. The survey design seems similar. In their approach seems similar to, if those of you who are familiar with the older, what used to be the date purchase syringe services survey across the country. So exciting to partner with them on that. We are part of this larger cooperative agreement, but try to communicate and help inform each other's direction and work as it goes. So yeah, exciting component over there. So our primary activities are really, for component one, are about really the nuts and bolts of providing technical assistance to syringe services programs and drug user health programs. We are hoping to create a national training network of regional trainers, recognizing that there are distinct needs and approaches and messaging that works well in different geographic regions, thinking about the Midwest or the South or the Northeast, and really just trying to, through identifying these regional trainers and building up really just trying to build up more nationwide capacity to do some of the trainings around harm reduction programs, what they are, why they're useful, and why we want them, why we want to support them. So that's exciting and to come. And then the component two is really about more about doing a deeper dive into what monitoring and evaluation and sort of data collection and surveying programs actually looks like across the country. So, I mean, the real question, is why this and why now, right? So we are so grateful that the CDC has really stepped up and really been trying to find, really been finding meaningful ways to support, increasingly support syringe services programs across the country at this point in time, really, developing new resources and recognizing that in recent years, there's just been an explosive and really exciting increase in programs across the country, and that there are lots of programs opening up because they're doing the right thing and they want to provide services. But as programs are opening up, training resources and resources for technical assistance are becoming scarcer. And so over the last 4 years, we've seen over 50% growth in syringe services programs across the country, which is amazing and so inspiring. We've, what used to be around 200 programs is now well over 300. And, again, the need for direct and specialized technical assistance to programs to really help make sure that best practices are being implemented as they're starting up is increasingly vital. Another recognition that especially for some new programs, but a lot of programs who have been around for quite some time, that a lot of technical assistance needs are becoming much more sophisticated and about not necessarily just harm reduction 101, but about a lot of different types of very technical aspects of programs, including testing and linkage to care and more intensive case management. So we're really excited to be a part of this project and to be part of the recipients to help do this TA and work with programs directly across the country. So what goes into all of this? We're really looking at, providing TA to basically anyone who's running drug user health or syringe access programs, syringe services program. So community-led agencies or any public agency-based syringe services programs. Again, talking about that regional network of trainers that will happen when we can travel again and see each other from different regions. And really looking at sort of the end of 3 years, really looking at having created and collated all these different resources that we will create based on TA requests and anticipate needs of programs across the country. And at the end of 3 years, really have a very sort of comprehensive combined sort of toolkit for resources that programs can kind of pull from to hopefully improve overall program effectiveness and capacity. And then again, a big part of this first year in particular is administration of this patient navigation demonstration project, which is underway and very exciting in itself. Okay, so I'm going to stop talking now, and I'm going to pass it over to my colleague Lily, who's gonna take us through the how-tos.
Thank you, Laura. Good afternoon, everyone. I'm glad to be with friends and colleagues today, especially virtually or in any dimension. So going into the actual provision of TA through the center, SSPs operated by both community organizations and health departments are eligible to receive TA through the National Harm Reduction TA Center by providing multiple types and areas of technical assistance under this project. NASTAD and AIDS United are committed to supporting harm reduction efforts in all of their bold, creative, ingenious, and often messy glory. So to that end, we've got TA formats to kind of wrap around programs depending on what stage of work they're at. These formats include direct support, webinars and shareable resources, trainings and curricula facilitated and developed by NASTAD, AIDS United, and other partners, and regional coordination efforts. Next slide, please. Thank you. As Laura said, we, like many others, are navigating delays and restrictions at the moment, but are glad to be formally launching the TA Center today. Through this webinar, the virtual town hall, and in following feedback, we look forward to identifying priorities and under-recognized needs among certain services and harm reduction programs. Our next steps will be creating and sharing resources, processing requests, and providing TA to programs, continuing to identify priorities and needs, and evaluating our own efforts to ensure quality support. So we'll be working with an external evaluator over the course of this project, and we're really excited to hear what they have to learn and to teach us through this process as well. Next slide, please. Based on experience and feedback thus far, we anticipate requests to address many of the following areas, including harm reduction philosophy and practice, funding and financial sustainability for programs, building out comprehensive health services for people who use drugs and people engaged in sex work, linkage to care, including sharing out best practices and program guidance from the patient navigation demonstration project that was mentioned, working with partners in local communities, tailoring programs in different rural, urban, and suburban contexts, criminal legal system considerations, and monitoring and evaluation. And if you've got anything to add to this list right now, please jot it down for the town hall segment that will be coming up later. Thank you. And finally, the process for requesting and receiving TA. Again, support is available to publicly and privately operated SSPs, including community-based organizations and grassroots efforts, medical and social service providers, and health department or other public agency-based programs. Health department-based HIV and viral hepatitis programs are not eligible for support via the TA Center, but those programs may request drug user health TA from our drug user health team through the CTS or HepTAC systems. Thank you. You will do this through the NASTAD website, nastad.org, which features a red request TA and training box in the top right-hand corner. This is a screenshot you see here from our homepage. And hovering over that box, you'll then select the blue harm reduction technical assistance link, which will take you to, there you go, our TA form. So when you're getting ready to submit a request or getting whatever information you need together to do so, we'll be asking for you or a program contact's name, a phone and email for follow-up coordination. You'll include the requesting organization or agency name, the jurisdiction that you are in from a drop-down menu, so it'll be state or territory, and a brief description of the request or issue at hand. In that description that you submit, please include any pressing deadlines or other time considerations, and we'll take that into account as we're evaluating and processing requests. Once the form is submitted, you'll hit the submit button at the bottom. The drug user health team will be notified, and then we'll reach back out to the identified contact to set up further communication. And now passing it back to Laura for questions about this first portion of the discussion.
Great, thanks, Lily. That is super helpful, and yeah, you know, we trying to keep this as clear and as straightforward as possible, both with this webinar, but also with this process overall, recognizing that there's you know, a real diversity of technological platforms and, you know, just ability of different programs across the country. So we wanted to keep this as low threshold as possible for people and programs to request help and any kind of assistance. You know, didn't need to, you know, really trying to make that really just focusing on accessibility. So I'm going to go ahead and just pause here for a little bit. Does anyone have any particular questions or clarifications, things they would like to comment on at this point in time? And as a reminder, after this, we'll move into more the virtual town hall and sort of guided discussion around emerging or current TA needs. So I'm gonna, let us all deal with some awkward silence for a minute. But any particular questions, as a reminder, you can raise your hand. Okay, we have several in the questions pane. And so you can use the questions pane or the chat box. Also, you may raise your hand and I will try to call on you. Okay, so yes, this webinar will be recorded. And yes, this webinar will be recorded and it'll be available on our NASTAD drug user health page. And is TA available for community-based SSPs that function in states where that function in states where laws prohibit SSPs? There is no, we are not in that business of necessarily, discriminating between the states where laws prohibit versus not. So yeah, any community-based group, whether you are incorporated or registered or operate in a policy restrained environment, contained environment or not, are eligible to request assistance. Let's see, have you considered having below that TA request TA box portals to all three mechanisms for requesting harm reduction TA, CTS, the capacity building, HIV requests, or whatever it's, and HepTech. It's confusing that there are three different mechanisms, and it'd be helpful to have them all in one place. So the drop down should include links to the other requests as well. And I think the CTS mechanism might not be on there because that is distinct to health departments, but it does include our other general TA requests. But we have definitely been trying to think strategically about how to make sure that we are making this as straightforward as possible. And particularly for, our rationale for using this request mechanism for the harm reduction TA center in particular was really just trying to minimize any potential barriers that, having sort of a dual factor identification or an extra log on information that programs might have to save and might, be lost or whatever. We wanted to create this to be as low threshold as possible, but we can certainly look into streamlining if we can touch base offline, if that proves to make sense over time. Let's see, the stated goals are very specific to injection drug use. Can TA also help need around other forms of drug use that are associated with disease transmission? Yeah, absolutely, absolutely. So we're really looking at more comprehensive drug user health and program operation, and so that will vary based upon region, upon drug, upon administration route of administration. So there is flexibility there. Yes, I already answered this one. So assistance is definitely available in states where SSPs are still operating in a gray area. And does the TA include help with passing SSP legislation? I would say not explicitly in this. I will say the thing that we can help with is about messaging with communities, tactics to build community support, tactics to create outreach plans, things like that. So there are elements there, but we are not providing direct advocacy. Is how I'll say that. So I'll just say that. Will state health departments that oversee local programs be made aware of TA requests in their state? And not necessarily, no. the way that NASTAD has historically provided drug user health TA and SSP TA to community-based groups has been via the health departments. And so really focusing on relationships and building those relationships meaningfully between health departments and programs has always been a real priority of mine. And I found really increases understanding on both sides about needs of programs, current trends, emerging issues. So we will continue to encourage that wherever and whenever possible. But if for instance, if we got a request and someone was very explicit that they did not want their health department to know, then we would respect that. But again, I mean, ideologically, like, I feel like that relationship is really vitally important, and I will continue, and we will continue to, encourage helping to build some of those relationships and be some of those bridges. And we can also talk through and provide TA on how to do that sometimes, So the question here is, how will this TA differ from the TA provided through SEBA? And so this is a really good question. So NASTAD has several mechanisms currently available to request TA for a variety of different programs and entities. So the SEBA, the Capacity Building Assistance HIV program is an HIV prevention program that NASTAD is also that we also administer from our HIV prevention team over here. SEBA in particular, Capacity Building Assistance, is only available to be requested through health departments or organizations that are funded directly by the CDC, and there is a unique login and different types of TA that are available through the SEBA system. So for those organizations that are either health departments that receive CDC funding or organizations that directly receive CDC funding, that's who's eligible for SEBA. And so this is much broader, given that very, very few syringe services programs across the country receive any direct federal funds. I hope that answers your question. Oops. Is TA available for all levels of operation, i.e. for organizations contemplating starting a program, as well as those that are already operating and trying to improve? Yes, absolutely. Yeah, and that's so much of the idea here is that we know that right now we're close to 30 years for some programs in the states, and we have some we have programs that are legacy programs that maybe need some guidance about modifying current approaches or adapting to emerging needs or trends. And then we also have programs that are newer to the game and just starting up, and really trying to find ways to make sure that that newer programs have what they need, and programs that are pre-existing have what they need in light of emerging trends. Okay. Yeah, so sort of just some follow-up about just communication and hoping for increased communication between health departments and the programs receiving TA. And yeah, I think that this will come as a case-to-case basis. And also, that communication, what I'll say is that, I think NASTAD has a really strong history of working with both health departments and community-based groups. And, I think that is part of why, we are uniquely poised to help the folks who are administering this program at this point in time. And I think that increased coordination and communication is like the solid foundation to any really good working and supportive relationship between health departments and SSPs. So it's always top line for me, and I'm glad to have more offline. Um, let's see. So that seems like the end of our questions at this point in time, unless there are any further. Let's see, is there anything in the chat box? Nope. I'm just gonna check hands here real quick. See if there's any hands. Okay. Any other questions at this point in time? Just a second more. Oh. Okay, so a question about when this will actually start. And the TA request mechanism is open as of right now, and has been open for the last week or so. So now, today. So yeah, we're excited to start fielding more requests and hear more about more about emerging TA needs, and that is actually a great transition over to the next component of today's webinar, the more virtual town hall elements here. So I am going to pass it over to, let's see, is it Kirsten? Kirsten, to lead us off. Kirsten? I know that we have been having some technical difficulties, so we might have to play this part a little bit by ear. Let's give this, okay. All right, so we can go ahead and just move forward. Apologies for that. You know, we're living in a brand new virtual world and have to be patient.
Hey, hey
Oh,
Laura,
hey, you're here.
Kirsten, can you confirm you can hear me?
Yep, we got you.
Great. Hi,
Welcome.
everyone. I know this is the fun part of doing my first NASTAD webinar. Uh, good afternoon. Really excited to be here with everyone. And this is the most valuable part for us and hopefully for you all eventually as we can get a sense of where you are, what sort of priorities are top line at the moment, what kinds of resources would be helpful. And we also want this to be an ongoing conversation, of course. So at this time, it's great for us to just start to get a sense of what people are seeing and where we can sort of focus our energies initially around creating resources, thinking about new projects or endeavors to help programs across the country. But of course, we will continue to welcome this kind of feedback and adapt in response to whatever needs are coming up. And even though we are limited in our ability to travel and do that in-person TA component, I think NASTAD has always been able to work with programs across the country in a variety of ways. So we do have a lot of mechanisms of being able to support programs, even if we can't be there in person. And in a funny way, this gives us some time right now to take a step back and do some exciting ideas generation and start cooking up some interesting resources for you all. So we have a few questions here that will lead us through, and also feel free to just to express TA needs however they occur to you. Again, you can use the chat box. You can use the question. You can also raise your hand so that we can unmute you and hear from people. I don't have the capability to see the questions or to unmute people, so I'm going to rely on Laura for that side of things. But just to open it up, what TA needs have been identified in your jurisdiction? And this can be under any of the categories that Lily mentioned earlier, regional coordination, stakeholder and community engagement, financing, funding, comprehensive drug user health services, or it can be something completely different that wasn't listed or maybe we haven't thought of yet.
Great. So we have one answer so far. Would really like to hear from as many people as possible. But we have an answer from some folks, all COVID at the time right now, obviously, but folks have been sharing resources daily, and I appreciate that because there's it's so interesting to be trying to roll out a virtual, this TA center right now, really thinking about both urgent, emergent, and long-term needs, and then also recognizing we have just, an incredibly different set of urgent needs in this moment. So NASTAD does have a resource page for HIV and hepatitis and drug user health programs around COVID right now, where it's a good repository of different resources and suggestions for health departments in particular about how they can support SSPs in this moment. And we're working with national partners to make sure that that we are increasing those as well. Okay, so let's see, harm reduction principles and practices to wider organizations that house SSPs. So if I'm reading that right, sort of really understanding, really working within larger, working, to make sure that everyone understands how to improve their work and with people who use drugs and kindness with people who use drugs within larger organizations and the importance of SSPs. That's great. Okay. Professional development and administrative capacity building for volunteer-driven, community-based organizations. Totally, yeah. This is definitely a space where we've seen a lot of need at this point. Programs are starting up and really need, a nonprofit or an SSP at any level needs people who can write grants, who can, who are good at, documenting, and tracking different data sets and data points for programs, and a lot of administrative capacity building is required, and this is definitely an increased need. I'm curious to know what best practices are coming up for other syringe access programs throughout the country through this COVID pandemic. Is there a way to compile those resources and guidance in one place? Yes, so there are, like I said, there's a NASTAD page, and there are several other pages that we link to within that page for COVID resources, specifically around SSP responses and program modification. And there's a great landing page that Vital Strategies and HRC and Higher Ground Harm Reduction have put together, available through the Vital Strategies website, and you can link to that from the NASTAD page as well. So securing funding to meet the need, and along with that, guidance on overcoming stigma on drug user health. Yeah, absolutely. I was already on a different webinar this morning talking about funding with some folks. So that is clearly an area that we have expertise in and would, are glad to focus on. Yeah, certainly overcoming stigma on drug user health. Stigma is probably the first or second most common sort of request that we get currently, and we're really hoping to build out a lot of resources on that. Okay, advocating for legislative change in a state where lobbying is not allowed by state employees. Yeah, so I think that in answer to the query that kind of came earlier, I think that we are certainly available and accessible to talk through building meaningful support for programs and communities and communications and messaging around that. So yeah, more to come on how, how we can go in that way. Meaningful involvement of participants and best practices for compensating participants for their efforts is key. And yes, certainly a very top line and vitally important part of programs that are effective. Glad for that. Appreciate that. Let's see, funding for sterile injection supplies. Again, yes, funding is very complicated and unnecessarily complicated, but we are glad to, yeah, we are glad to talk through some different potential options and resources for that, and be based in a webinar resource, whatever makes the most sense. Let's see, evidence-based protocols and best practices for not only new organizations starting services, but also legacy programs who are set in their quote unquote old-fashioned ways. Agreed. Yeah, noted. I appreciate that. Again, sort of really diversifying to meet both current and emerging needs is how we've been trying to really think about the way that we can show up here. We have a second to administration capacity building. Yep, and those are clearly needs that are top line for us as well, recognizing that those are emerging program needs, things like writing grants, tracking outcomes, running an organization, etc. Yeah, absolutely. I think, yeah, grant writing and language, the primer on that would be great. So thank you. Community-based participatory research models for evaluating programs. That's a great suggestion, and I think that there are a variety of different ways of doing program evaluation, and so that is a really, I think that'll be a great way to a great resource that could be created, and thinking through types of assistance, that would be super helpful. So this is from someone who attended a boot camp in Utah and a train the trainer in Las Vegas. Will trainings, like, I assume this is like in-person trainings, be offered in rural areas? And yeah, there's nothing to say that dependent upon the identified need and the request overall, there's a lot of flexibility in the different types of technical assistance that we can offer, and capacity building assistance we can offer. So glad to talk through some potential options for making sure trainings and technical assistance reach rural areas as well as urban or suburban. Guidance to people who make health messaging but might not work directly in HR. Yeah, I think communications is a big part of ongoing technical assistance needs. So great, it's excellent. I really appreciate everyone's participation in that. So we have a couple more prompts, so I'm going to pause here and we're going to move to the next prompt. I think is probably the best thing to do at this moment, but I really appreciate everyone's thoughts about current needs.
Thank you so much, Laura. So thinking about some of the needs that we just identified, we want to hear from you. Which formats have you found to be effective, or do you think would be most effective for receiving harm reduction TA, and why? And in-person trainings absolutely are part of this, even though we're limited at this time. So definitely think broadly in terms of trainings and other in-person TA, as well as kind of virtual, online, or written resources.
Great, so we got one here, a couple here that say in-person and webinars are effective. And I think, I totally agree. And I think that, given how we're going to have to be flexible both now and sort of moving forward for a bit, we're going to have to be kind of creative about this. And one of the ways that we in general approach TA over here is, really once a request is submitted, we'll really talk through what are potential options and what's available and what feels like most accessible and effective for each individual request. Yeah, a real emphasis on the importance of some types of training and TA being in person, that especially for teams that will be delivering services together, really thinking about the importance of the sort of ensuring some of the team building and ensuring values and really value setting about what the programs are designed to do and how they're going to show up and do that. I agree that sometimes in person is a really and vitally important way to deliver different types of TA. A question about if there will be any online harm reduction trainings available through you, and yes, I think that is certainly we'll have probably either explicit webinar based trainings or like registration like this, different segments, and we would be glad to talk through any particular ones that that feel like they would be useful in the short or long term, or immediate or long term, and glad to be creative with folks on that. This is a suggestion about sort of peer-to-peer social learning from SSP to SSP. So a really, I agree, a very creative way to be virtual. So NASTAD has a long history of doing this with health departments in a variety of different ways, is really connecting programs and health departments that are in similar situations to each other to do some of this peer learning. So it's certainly a thing that we would love to expand and adopt broadly, but also in this time when travel isn't really very helpful. Very good suggestion there. Yeah, so another suggestion to figure out how to have some regular calls or more focused like work group calls of a sort, so long as they're this person says, so long as they're a chance to be real with each other and complain about what's not going well, celebrate what is, etc. And I really understand that. And I think, there are, again, NASTAD has a long history of hosting different levels of calls with either regional or different stakeholder staff or I'm sorry, agencies within within health departments or programs within health departments. So glad to be really helpful, really thoughtful about what makes the most sense to be hosting that sort of call. Yeah, so I mean, a great idea that might be a call unto itself. This person would like to see states really linked together for particular states that are, I would say, policy constrained, who might be operating in a legal gray area or not have legal syringe services programs, and how sort of programmatic best practices within sort of that resource constrained environment. Thank you. Yeah, I think that would be great. Good idea. This is a suggestion, especially given distance considerations, that from a state that has quarterly meeting requirements for their syringe services programs, and recently those are primarily video calls. So if it's a small enough group, you can have sort of a Zoom meeting or a go-to meeting where we can all see each other, and given the recent travel restrictions, or in states that are geographically quite large or spread apart. So I appreciate that. It's a great idea. Okay, so I think we're going to pause again here because we do have a couple more prompts and move forward. Work. All right, so moving on to this next slide.
Thank you, Laura. And I'm going to pass it on to Virgil.
Thank you so much.
Thank
Great.
you, Kirsten.
Thanks, everyone.
So continuing on with the questions that we are posing to you all, which areas of technical assistance or program support do you feel are under addressed?
So thanks, Virgil. I'll just tack on. I was walking, went on a quick walk, which I'm allowed to do, right before this call, and I was thinking of this as like kind of the $1 million question, like if you could have any resource, like that would be like if you could have a resource that would be helpful, like any resource that would be helpful, like right now, that you don't currently have. What is it? Great, thank you. So admin, leadership, capacity building, funding. Amen. Sorry. Yes, thank you. Funding. Division of labor, support to staff. That's great. Yeah. Grant writers and or training to do so. Perfect. Let's see. Operations support, inventory systems, and funding diversity. Yeah, thank you. I appreciate that. Navigating complex health systems and bureaucracies for programs that by definition and scope have always been organized outside of these systems. Yeah, I think that's that's a really, these are all great suggestions out here. Yeah, and thinking about what it looks like to even better understand the systems. Great, thank you. Second for inventory. Okay, great. Trauma-informed care for training for harm reduction workers. I think that's a really great thing to be focusing on, and is certainly a priority. And we are currently working on some trauma-informed care resources right now. More capacity for creating collaborations between housing providers and syringe services programs. Helpful best practices for getting people who use meth and have a past conviction get housed, as well as more specific programming around meth use and responding to overamping in the community. Yeah, thank you for bringing that up in terms of drugs that are not explicitly opioid or polysubstance use. We are flagging, and currently we have some resources available around stimulants, but we would like to really beef that up. So I appreciate that. And the focus on housing and diversifying different different partnerships, community partnerships is a great suggestion. Coaching and support for harm reduction supervisors. Great suggestion. Great suggestion. Data collection tools and technology to allow programs to collect data for funders that allows for programs to still be responsive to mobile-based services. Yeah, this is, data collection is, and sort of doing a deeper dive into that is certainly something that we can focus on, but I will say is also a focus of that component too of the other part of the cooperative agreement. So they really dovetail nicely in that. Thanks for bringing that up. Policies and procedures for when employing people who use drugs and self-care. Appreciate that, absolutely. Really vital, and would be great to have more resources on in addition to what we already have out there. Technical assistance around data collection and evaluation systems for SSPs that are inexpensive, not complicated, and user-friendly. I couldn't agree more. This is definitely there are a lot of different models of how programs collect data out there, so glad to really do sort of a survey of that and also work with that component too of this larger cooperative agreement to handle, to figure out some of the better strategies around doing that. Program and people management. Harm reductionists are amazing, but also hard to manage. I like whoever this person is. but also hard to manage because of their natural leaning towards rebellion. How do we balance passion and working within a system? I really appreciate this very real statement, and it kind of goes back to the other comment about melding sort of harm reduction with more bureaucratic systems, and trying to really figure out what the best practices are there. Yeah, working within systems at this point. Yeah. How to keep people who use drugs and people who identify as being in recovery at the table. I couldn't agree more. Again, participant involvement is a top line need, and really vitally important to effective programs. So glad to focus on that. A question about requirements for supervising peers who are credentialed. I think that makes, those two together make a lot of sense. Thank you. Mobile unit outfitting guides and suggestions. So sort of a peer-to-peer, what have other programs done, what works best. I think that would be great. Thank you. Language for approaching harm reduction from social determinants of health perspective. Sure thing. Yeah, I think communications around programs and, again, kind of building those bridges between public health and programs and community are all really great places to focus. Thank you. Great. Okay, so it seems like it's, one more, and then we're gonna probably move on to the next little prompt. And then, okay, so tailored harm reduction programming and services for communities of color that addresses intersection of race, inequality, drug use, and criminal justice. Yeah, thank you for that. Really bringing in more of the environmental understanding and social understanding of drug use and the environments and current and historical health disparities that are present is a great thing to focus on. Great. So I really appreciate that. We're gonna push forward, and there's, feel free to keep typing into the chat box, and we'll get to you. So Virgil, do you want to take it back over?
Yes. So for this next question, we're looking for how can NASTAD best promote TA efforts and resources with partners? What are some of the ways that you feel we can improve upon promoting TA efforts and resources with partners?
So it feels like some of the other requests or the other suggestions have touched on this a little bit, but I think what we're looking for here is like any particular TA that you could anticipate needing specifically around building relationships and within communities, or some of the building community support with other stakeholder groups or other partner community-based groups or agencies within your communities. So a suggestion for a sort of monthly newsletter to let us know what's coming up or was recently produced. I think that's a great idea. And we also will show you at the final slide here that we have a drug user health listserv here at NASTAD, and there is now join the listserv sort of click box on the page, the request TA page. So yeah, really glad to kind of flesh that out more. Yeah, again, the idea of connecting programs that are newer or younger to other SSPs that are newer or younger, sort of a cohort learning model, I think would be great. I appreciate that. So a suggestion it sounds like to some of the community partners about how to connect, is really focusing events on, making sure that there's like space that provides food and, like really creates a comfortable environment for folks to come together to create local coalitions or community based coalitions or working groups. Okay. So any other, I don't want to belabor this too long because I know that we're, I don't want to use people's time if it's not necessary. So feel free to continue to put any other suggestions about either relationships to have connected or other building support with other community stakeholders or community groups or agencies or any other chat, any questions about TA modality or delivery mechanism or topics. Feel free to keep typing those in. I think we'll go ahead and push forward on this one. And in addition to that, I would say, if there are any sort of outstanding questions about either the TA that is available to be provided or about the harm reduction TA center or any of its components at this point, please, I'm going to give another minute here just to let people kind of mull over what we've presented. And if there are any outstanding questions or comments, please feel free to enter them in and we'll get to them. So I'll give just a moment for that. Well, thank you for you all as well. Let's see. Okay, so please help us make the case for public health to have a place at the table in the world of harm reduction. Yeah, I like I have said several times, we have always really focused on, building that relationship when and where possible and different strategies to do that. And I think that is an ongoing value that we hold where and when possible. And we're glad to continue to strategize about ways to do that because I think it opens so many different doors in terms of funding and support and understanding. So thank you. Great, and thank you, everyone is being very nice and kind on these questions or comments right now. So if there's nothing else, I just want to say to everyone, really appreciating you. And really appreciating you for being so engaged and encouraging and accepting, of this new TA center. We're really excited to get this off the ground. And we, appreciate and hope for, everyone we hope for our inbox to be flooded here in a minute with different TA requests via the new TA request mechanism. So I just want to appreciate all of you and Virgil, do you want to explain anything about the drug user health mailing list or how to sign up for that?
Yes. So if you're looking to sign up for the drug user health mailing list, simply visit www.nastad.org/drug user health. And we can get you signed up and added on to the drug user mailing list listserv to keep you up to date on everything that is going on here at NASTAD and Team Duh.
Duh. Great, thanks, Virgil. And here you'll see, all of our contact information. We're all very easily found. If you just go to the NASTAD website, you can find all of our emails on that website. And we really, are excited to get requests through the TA request mechanism, the request function. But, we have always had a guiding principle of a no wrong door sort of entry. So if it is ever easier to just reach out with a personal email, professional email, or, if TA needs are emerging, we really welcome all kinds of TA to come to us or our partners over at AIDS United, and we are just really looking forward to getting this off the ground. And yeah, I just appreciate everyone taking the time today. As a reminder, this webinar will be made publicly available, and we have taken copious notes, and we'll be working on a lot of these initial primary priority projects right away. So thank you again, and I hope everyone has a lovely day, and that we'll hear from you soon.
Thank you, everyone.
Have a great one, everyone.